Okay, let's unpack this. We are diving deep today into sources that tackle a really specific frustration.
Hmm.
That feeling, that many parents know really well. You seek help for something persistent, maybe pain after birth or baby's feeding issues.
Right.
And the advice you get is just, let's wait and see.
That phrase, wait and see, it sounds reasonable maybe, but when you're exhausted, running on fumes, and your gut is just screaming that something isn't right,
Yeah.
it feels, well, incredibly dismissing. It's really hard to just accept things will magically get better when you're feeling so depleted already.
And you are absolutely not wrong for wanting something more proactive. So our mission today is exploring sources that talk about an alternative.
An alternative based on gentle, natural support for the whole family.
Exactly. And founded on this idea that your intuition as a parent, it's actually a vital tool. It deserves to be heard, respected.
And what's really striking in the sources is how often mothers are told their discomfort. The back pain that won't quit, feeling totally wiped out, the baby's reflux.
Yeah, the list goes on.
That it's all just normal. It's like this cultural default setting, an expectation to just push through.
Right, just accept a lower quality of life because, hey, you're a parent now.
It shifts the focus from healing, from recovery, to just endurance, surviving it.
And that expectation, just enduring, brings us right here. Identifying that big gap in conventional postpartum and pediatric care.
Yeah, the source material gets really specific about the kinds of issues that often trap mothers in that wait and see loop. We're not talking vague feelings here.
Yeah.
No, these are tangible physical concerns, things rooted in the body's recovery or the baby's function.
Okay, give us the details. What specific things are often, waved away?
Well, they talk about how often new moms hear that postpartum back pain is just expected. It'll sort itself out eventually.
Like the massive structural changes of pregnancy and birth don't matter.
Exactly. Or ongoing struggles with breastfeeding or the baby having really persistent colic or reflux.
Mm-hmm.
Those get labeled as just phases.
They'll grow out of it. Right.
Grow out of it. And that general feeling, just being utterly depleted, sore all over,
Yeah.
that's just framed as like the cost of admission.
Yeah.
Part of being a mom. Accept it.
Wow. That acceptance really does create more of a survival mode than a healing one.
Totally.
And connecting this back, that survival mentality is exactly what the alternative approach we're looking at wants to dismantle.
Yeah, the core idea, the philosophy here, it's a direct response to that dismissal. It's this fundamental belief in finding and addressing the root cause.
Not just masking symptoms.
No, addressing the root cause with respectful, natural care for both mom and baby. Not just settling for surviving those tough early years.
And the search for the root cause, it's not just like a gut feeling claim either, is it?
No, the source material actually backs this up. They mention findings, for instance, from the American Pregnancy Association,
Okay.
suggesting that proactively seeking natural support postpartum can really ease recovery. It can improve well-being for both mom and baby significantly,
So it moves beyond just symptom management.
right? Into actually optimizing function, getting things working properly again.
So if the big problem is this kind of generalized dismissal, the solution has to be in care that's more specialized, right? Something that goes deeper.
Yes, a model that actually respects the complexity, the postpartum body, the developing baby. It's intricate stuff.
Which brings us to what this gentle whole family care actually involves, because the sources describe something pretty different from maybe typical assumptions.
Yeah, it's definitely beyond just, a quick adjustment. It really emphasizes specialization.
Okay, let's unpack that. Gentle whole family care. The sources say it's rooted in comprehensive training. What does that mean in practice? Especially for a newborn or a mom who just gave birth.
It means the practitioners have gone through really specific, dedicated training. It goes deep into, like, the biomechanics of pregnancy, birth recovery, how a baby's nervous system develops.
So not just applying adult techniques to babies or new moms.
Yeah, absolutely not. They often have advanced certifications, maybe in things like the Webster technique, that's for pelvic balance in pregnancy, or extensive training in pediatric techniques that are really low force.
Low force.
Yeah, focused on infant alignment, nervous system function. This kind of deep expertise lets them approach care with precision and compassion. The sources really highlight that.
Precision seems like the key word there. They specifically say they avoid, what was it? No assumptions, no pressure, no pop and pray adjustments.
Right.
That phrase, pop and pray, is pretty evocative. It signals something very different. Can you contrast that for us?
Yeah, it's a really important distinction. Pop and pray is that unfortunate stereotype, right? A generic, maybe forceful adjustment where you kind of hope it fixes the problem.
Okay.
The alternative described here is completely different. For postpartum women, for infants, it uses extremely gentle, light touch techniques, very low force.
So we're talking really targeted, subtle corrections,
Yeah,
not big movements?
absolutely. Sometimes the adjustments might just involve the pressure of a few fingertips. Very specific. It relies on careful feeling, palpation, assessing how things are moving functionally, not brute force.
Right.
And that difference, that gentleness, it builds trust. And it allows them to safely work with delicate structures, which is obviously crucial for infants.
Yeah, thinking about how tiny they are.
Exactly. And infant alignment issues often stem from the forces involved in birth itself, even a seemingly smooth delivery.
That makes sense. Even a normal birth can be a lot for a little body. Can you give concrete examples of the baby issues this kind of care addresses? You mentioned latch issues, but more specifically.
Sure. The sources talk about addressing structural restrictions that cause functional problems, like torticollis.
Restricted neck movement.
Yeah, where the baby can't comfortably turn their head one way.
Right.
That directly impacts feeding, latching symmetrically, even sleeping well.
Okay.
They also address movement pattern issues that can come up after, say, a C-section or maybe a vacuum delivery. Those interventions can create specific tensions.
And you mentioned digestion earlier, too. How does that connect?
Crucially, yes. They look at digestive discomfort, colic, reflux, that sort of thing. They often connect subtle misalignments, maybe in the upper neck or mid-back, to nervous system stress.
How so?
Well, if the nervous system is kind of stuck in a fight or flight stress state because of misalignment, it can actually interfere with proper digestion.
Ah, okay.
So you see symptoms like colic or really bad reflux, general discomfort that maybe isn't fully resolved by medication alone. It connects the baby's physical comfort, their structure, directly to how well they can eat, digest, and just thrive.
That really does sound like whole family care then. You're supporting mom's recovery structurally, pain-wise, and at the same time optimizing the baby's function.
It's an integrated approach
Yeah.
that respects the connection, the diet.
And respects the challenges of that whole postpartum period.
And as the sources keep saying, it all starts with listening. Listening to the patient's story, their intuition, that tailored approach, valuing the parent as the expert on their child. That's often missing when healthcare feels rushed.
That focus on listening, that's huge. And it brings us to the emotional side of this whole thing. When we talk about feeling heard, that story, Brooke R. from Fonda and Why, it really paints a picture of why validation matters so much.
It really does. Her story perfectly captures that sense of isolation, right? When what you feel inside clashes with what you're being told externally.
Yeah, she said she felt like a shell of myself, exhausted, sore, and invisible after her second baby. Just gone.
And the kicker is, she went to her pediatrician, right, who checked the baby and said everything was fine. But she knew. She felt it wasn't fine for her.
Okay, wait, let's dig into that disconnect. If the pediatrician says the baby's fine, what was this other provider looking for or assessing that was different? How did they find a root cause for her feeling like a shell?
That's a great question. The difference is really in the goal of the assessment. The pediatrician is rightly focused on health markers. Is the baby growing? Hitting milestones? Any signs of disease?
Standard checks, okay.
A specialized practitioner, like the ones described, is doing a functional assessment, particularly on the mother in this case. How is her pelvis, her sacrum, her lower back actually functioning after the huge demands of birth and hormonal shifts?
Ah, so looking at the mechanics.
Exactly. For Brooke, it likely meant finding significant pelvic instability, maybe deep muscle tension patterns contributing to her chronic pain, that feeling of depletion, the fatigue.
Things the traditional checkup might just chalk up to, well, you just had a baby.
Precisely. Issues often dismissed as just a consequence of motherhood, rather than addressable biomechanical problems.
So that shift for her, moving from having her own experience kind of brushed off to feeling like her story mattered, that's what she said made the huge difference.
Yeah.
Going from just surviving to feeling like me again, that's transformative.
It really is. It's the combination, isn't it?
Yeah.
The physical correction paired with that emotional validation of feeling heard.
Yeah.
So what here, the insight for you listening, is recognizing that seeking care that feels intuitive, respectful, strong, it's not just about getting rid of pain.
No.
It's fundamental for mental and physical restoration. The kind of care described in these sources, it validates the sheer effort and intensity of mothering itself.
And you can see that holistic view extending beyond just the immediate postpartum stuff, too, looking at the other related topics they mentioned.
Right, things like, is chiropractic safe for babies?
Hmm.
But also broader wellness pieces like breathe better, stress less, and posture is power.
It shows it's all interconnected, doesn't it?
Absolutely. It points to this core idea that physical discomfort, stress,
Right.
how you hold your body,
Yeah.
it's all linked.
If your posture is poor because you're weak or compensating or you're constantly stressed, your body just can't recover efficiently. Not from birth, not from the physical demands of lifting, carrying, feeding. The philosophy seems clear. Getting your structure stable and calming the nervous system down are key for long-term wellness, not just quick fixes for symptoms.
So the goal is to stop accepting feeling just okay or run down as the baseline.
Right. And start proactively building resilience, getting to the roots of the problem. Hashtag tag tab a post. So boiling it all down, the key insight from this deep dive really is that search for specialized intuitive care. It's completely valid.
Yeah.
You're right to want a professional who looks beyond the surface symptoms, who actually honors your intuition, especially when you're dealing with those persistent postpartum issues or kid issues that maybe get dismissed with that easy wait and see.
You absolutely deserve to feel heard, seen, and crucially, not rushed. The core point these sources are making is that discomfort, depletion, they aren't just unavoidable dues you pay for being a parent.
They're often manageable issues, rooted in alignment or functional stress that can be addressed proactively with the right kind of specialized care.
And if tackling the structural root of pain and imbalance is key to feeling like you again,
Mm.
moving from just surviving to actually thriving,
Yeah.
it does raise a really interesting question about where else in your life you might be accepting discomfort unnecessarily.
Which leads us perfectly to our final provocative thought for you to think about. If your physical well-being can improve so much by moving past wait and see and looking for root causes,
Mhm.
what other areas of your life, maybe not physical like stress management or that idea of posture and awareness they hinted at, what else could benefit from ditching the just wait and see mindset?
Exactly. What assumptions are you making about your own stress levels, maybe your energy, your capacity for just feeling good
Yeah.
that you're currently accepting as normal?
Things that could actually be addressed if you prioritized care in whatever form that truly listens and looks deeper.
That shift in perspective,
Yeah.
that's powerful stuff. It could really change the game.
Definitely something powerful to chew on. Thanks for joining us for this deep dive.